Okay, next we have reentry programs and services. And so we have PERC, which is People Empowering and Restoring Communities. They have Brandy Stroh, who's a PERC counselor. And PERC helps the offender become an ex-offender and remain an ex-offender, reunited with family through advocacy, education, programming, and comprehensive service delivery and referral.
I couldn't
Brandy.
unmute myself. Yes, I got it.
Oh, no problem. We understand how tech works. Thank you so much.
Yes. If you can go to the next slide, please. And the next slide, apparently. Okay. PERC has several different, my mind just went blank. I'm so sorry. I'm not a very good speaker. But anyway, I'll just get into it. So we are partnering with St. Pete Works and the Second Chance Tiny House program. This is a pre-release and community-based construction advanced manufacturing training program that we do. This has stacked certifications, and anybody interested in these programs in the community-based versions can reach out to us. We have the contact information later. Florida Hires, these are programs and services that we offer. Florida Hires with the tiny house and low voltage training. In part, what funds the pre-release training is the Florida Hires. This program, we're developing a new training program, which is the low voltage training. And this training is going to be focused more on pre-release population than the community. Another program is the St. Petersburg Hub program, and we're in partnership with them and the Gulf Coast Jewish Community Family Services. This is designed as a one-stop shop for mental health, substance abuse, or any other kind of case management needs. Potential clients in St. Petersburg can go to 1601 16th Street South for any mental health, substance abuse, or case management needs. And it's pretty much open-ended to anybody who lives in St. Petersburg. We have the outpatient substance abuse groups, and we work with DOC clients on probation, providing outpatient substance abuse treatment and using the Seeking Safety guidelines within those groups. Groups are offered in multiple locations in Tarpon Springs, South St. Pete, Clearwater. We have those in Newport Richey, and I believe Zephyr Hills as well. The Continental Housing Program, which is in Clearwater, is a self-paid dual occupancy for homeless individuals with a criminal background or probation stipulations. We provide case management services for them in order to help with reentry, food stamps, bus passes, that type of thing. It's $850 a month for that, and we do not take families or any minors on this property. We also here at the Continental have a transition in place program. We are partnered with the VA to house high-income homeless veterans with eviction history, a criminal history, substance abuse history, dual diagnosis. The VA pays for 6 months while the vet works with the case manager to reach goals, buying a car, paying off debt, getting a job, purchasing a house, that kind of thing. After 6 months, the veteran has an opportunity to rent the apartment he's staying in, or she are staying in. They transition in place, and they sign a lease for $1,300 a month for the first year. And then the rent will increase for any subsequent year that they're here. Typically, we have veterans who've been here for years, you know. We also are contracted with HEP, the Homeless Empowerment Program, to ensure that the needs of the grant per diem, the GPD veterans that are housed there have their their needs met as far as mental health and things like that. Another program is the Cohort of Champions. This is an initiative for middle school and high school age kids in South St. Petersburg to help them with pro-social activities, learning about employment opportunities, yoga, different things associated with that. There's also support for the parents of those kids as well. That's tied to the Hub program. Then we have IDEA, Pinellas Harm Reduction Program and the Syringe Exchange. That's in St. Petersburg as well at the Welsh Plaza. That's part of the Pinellas County Solution for Opioid Addiction. This includes counseling, wound care, helping people get into treatment, as well as safe syringe exchange. We're hoping to expand that into the North County next year if we can figure out the funding for it. We were granted opioid abatement funds in St. Petersburg, and we have received that grant for the IDEA Pinellas in St. Petersburg from the city. We have general case management. That's for people who have are criminally justice involved or not. So anybody who needs case management services can come to our location either in South St. Pete or the Continental in Clearwater. The programs that, oh, we can change the slide. Yeah, I'm sorry. The new programs for 2025, 2026, because some of them are going to be coming in 2026. We have vocational rehabilitation. We're working on becoming voc rehab provider to offer more training services for underserved populations. And we're in the process with voc rehab right now to establish that. The Empowering People program, the Bureau of Justice Assistance for pro-release training. The federal grant we received is for people who are criminally justice involved. It's pre and post-release training program. It's also in support of the low voltage and tiny house program. So if anybody knows anybody or we know anybody that has pre-release who needs services, they can reach out to our career specialist, Rich Alvarez, and we'll have his information. We also have a PERC CASA tiny home project. So we are partnering with CASA to build a tiny house village and a family justice center off Turner Street in Clearwater. It's in the works now, but it'll probably be 2026 with the opening date. We have the ZAC Initiative Transportation Program. That initiative that's going to be working on getting people to and from work. That's launching in the next month or so from different locations, including HEP, SPC here, and several other places. The opioid abatement funds I've discussed. We have a new social enterprise. We're creating an enterprise specifically geared toward training and opportunities in plumbing, electrical, and AC for people with backgrounds. That's something that we're actively trying to launch right now. Feeding Tampa Bay and Pinellas training program. We have a commercial kitchen here at the Continental in Clearwater, and we're actively working toward creating that kitchen to assist with culinary arts program. We're not sure if Feeding Tampa Bay is going to be in that with us, but we're hoping. So that's going to lead toward more employment with the service industry, specifically in the culinary arts. And then the federally qualified health center. So we're looking to open our own lab and considering opening our own pharmacy because of the work we've done with IDEA Pinellas and the wound care. And because of that, we're going through the process where we can look into helping federally qualified health centers, both in North and South counties, in support of the clients that we work with. The final one is Operation New Hope. We are partnering with Operation New Hope in St. Petersburg for the criminally justice involved, whether it's getting them ready for work, helping them with employment. but it also includes housing. So we have some rooms available here, and they pay for the first 3 months to get people on their feet and get them in jobs. Justice impacted. Yes, I like that. Okay. Thank you, Andrew. And that's all I have for now. They didn't give me a slide with the contact information, but I'll put our contact information in the chat.
Thank you very much,
You're welcome.
Brandy. Yes, any questions that you have? Again, we want to make sure we had extra speakers tonight to share the resources. And so if you have any questions, please put them in the chat and we'll make sure to get them back to Brandy, or of course, you can always respond here as well. Thank you very much. There is one question though I want to touch on before we go. Brandy, you don't get off the hook that easy. How can someone send a referral?
So typically, they either call one of us. It really depends on what the referral is for. So we have, like, I do the housing program as well as the GPD program, as well as assessments for anger management, sex offender, that kind of thing. So it just really depends on what the referral is for. And once we know that, then we can send it to the right place. But I'll put all our information for the different referral process in the
Okay.
chat. Okay.
Thank you so much.
You're welcome.